Once again, this is a video that is supplemental to the cranial nerve therapy class that was presented here at Chagrin Valley Wellness Institute on cranial nerve release techniques for the massage therapist. What we're going to be going through this video is to review the palpation skills necessary, to remind you that nerves do not stretch, that they glide and or slide. There's no movement will be experienced by the therapist, only a lessening of the tension. Patience is going to be a major virtue in this. You need to allow the process and then follow the process. And the palpation skills are going to be reviewed once again for you, that we have to understand that where the cranial nerves come through the brain is they go through the dura mater and also the tentorium cerebelli. So this is a fascial expression. So as they come through here, we have to remember that the fascia is going to be the first layer. Then you're going to have the nerves, and these are going to represent the vagus nerves. As you can see in this picture, how the vagus nerves come off for the brain and then come down both sides of the trachea with your glands in through here. So that's what these two spaghetti noodles are going to represent. Over the top of those will be another layer. And by being in the layers of fascia, the nerves have an ability to be able to slide. As movement takes place, they can slide and glide. Because if there's a restriction there, you can't. And what will happen is you will pull against the spaghetti noodle, and that's what will happen. But the nerve doesn't break, whereas the spaghetti noodle does. That worked out well. And then over the layer of that, you will also have muscle, tendon tissue, but then the hardest part is actually being able to palpate through the skin, because the skin is a movable organ that is in constant growth, expansion, and contraction. So by palpating, you're going to have to be very patient to understand that what you're going to feel is something that is going to be as rigid as a spaghetti noodle, but being able to move. And if you use too much pressure, you're going to actually adhere the nerve to the underlying tissue so that it will not be able to glide. So as we go through, and we remember that no movement is going to be experienced, with the tension will be lessened, is going to be the critical part to your palpation skills. Also, you have to lay your hands there and allow the nerve to come to you, because it's not going to want to. It's going to be in hiding, and it's going to be deep in there, and it's probably the hardest to palpate. And that's the reason we're doing the cranial nerves before we do the peripheral nerves, because they're even more difficult to palpate.